It's now my honor to introduce our keynote speaker, Dr. Teresa Stevens. Dr. Stevens is a national leader in resilience, trauma-informed care, and the science of workforce well-being. Her research and teaching have shaped how healthcare organizations across the country have responded to stress, moral injury, and burnout among frontline workers. Today, she will deliver her keynote address, Back to the Future in Healthcare, Reclaiming Our Purpose Through Resilience and Courage. In this session, Dr. Stevens will take us on a journey that looks back at where we've been, honors the challenges we continue to face, and points us toward a future where nurses and social workers can both thrive. Please join me in welcoming Dr. Teresa Stevens.
Thank you so much. It is such a pleasure to be with all of you today. I really appreciate the opportunity to share some of my passions that align very well with the summit theme. It's something that has been at the core of my work and in my heart for many, many years. And I appreciate everything that I've heard so far and all of the wonderful things you're doing in Louisiana to improve the state of the healthcare workforce. I'm going to share my screen and invite you to follow along as we go back to the future. Let me pull this up here. Let's see here. There we go. All right. Are you seeing a slide that says Back to the Future? Okay, awesome. So I'm showing my age here. We're going to go way back in time, but I'm going to ask you to join me, and you can scan the QR code with your mobile device or your phone, or you can go to the web address that's on the left of the screen, because I do want to hear from you, and I want you to have you participate. Your responses are anonymous. And you can see in the bottom right of the screen how many people have joined so far. And you can play around with your little emojis and send thumbs up, whatever you want to do there. I like seeing those pop up. And I will keep the QR code. There we go. Awesome. I'll keep the QR code and the address at the top of the screen for the next few slides. So if you haven't joined yet and want to do so, you will not lose that as I advance. So, the title of my presentation is Back to the Future, Reclaiming Our Purpose Through Resilience and Courage. And as she said, my research has been in resilience, specifically with nurses, but also with interprofessional teams for about 20 years now. You'll hear a little bit about that in the presentation. Most recently, the last 5 to 6 years, I have been working within the concepts of resilience, moral courage, and a sense of purpose, specifically in academia with nursing faculty and academic nurse leaders. But a lot of it we are able to apply across all healthcare workers. So, a lot of my work has been spent looking at the past and what are the lessons that we can learn from history. Much of my model and my work in resilience has been based on work I have done with Holocaust survivors. And so, really looking at their narratives, the stories that came from the Holocaust, specifically around leadership, around courage, around change, and all of those different things that affect well-being and wellness have come from those stories. I was never a big fan of history in school. In fact, that was not my best subject by any means, and I regret that because now I just devour it. I absolutely that is probably my age as well, that I really understand the power of historical narratives and how much it can help us dealing with current challenges that we face. So I'm going to ask you a question now. What is the purpose of healthcare? And you can answer this on your screen, and I want to see what your response is to this. What do you believe is the main purpose of healthcare? And I'll give you just a few seconds. to keep people healthy. It's very simple, isn't it? To care for sick patients, prevent disease, overall wellness, prevent illness, healthy populations, to provide presence when others need it, optimize health, to care, to treat sickness, restore health, service to patients, better quality of life. Getting a lot of the same themes here, aren't we? It's about others, caring for people, optimizing health, addressing illness, wellness, the vulnerable, love that, promoting well being, optimal health, holistic care. All of these have something in common, don't they? It's an outward focus, caring for others, and it's about getting people to a state of wellness and well being that is optimal for them. So it's about caring for others. It's very service oriented. And we're going to learn just how important remembering this is when we talk about wellness and well being of the caregivers. This is important to us. This is what we view as our purpose in what we're doing. So, thank you so much for participating in that. I'm going to go ahead and advance for the sake of time, but I will give you a copy of all of these responses for the hosts. So, when we think about healthcare and as it relates to the past, I've been in nursing for almost 40 years now. And when I first entered nursing in the early 80s, it was a very different time and place. And I've been really looking at the different ages of healthcare. A lot of my work is around technology integration, um, utilizing technology, and I love that that's one of your goals you mentioned at the very beginning, using it wisely and purposefully. So when we think about the changes that have occurred in healthcare, there are three big things that I have observed in my own research that have greatly contributed to our current state. One is the introduction of evidence-based practice. The second is the internet. It hasn't always been around. And then the third is the financialization of healthcare. All three of these have came about during the information age, which we began in the mid 20th century, but really started to advance very rapidly in the 1980s and early 1990s. We know the evidence-based practice came about officially the late 80s, early 90s when it was first being published about and really talked about. The internet as well. And then the financialization of healthcare began when we started looking at managed care in the 80s and looking for answers to the problems that we had around access and treatment. So, all three of these three things I find as recurrent themes in my own research and looking at how do we address the workforce challenges that we have. We have to look back to think about this. So we're going to look at 1985 as our starting point. And this is when the movie Back to the Future came out. So this is its 40th year. Did you all get that? Okay. So 1985, we were in a completely different place as a world and as a country. And everything in that movie, if you haven't watched it recently, I encourage you to do so. But everything in that movie seemed so futuristic. And I remember as a child and in middle school, especially coming home from school, I loved Star Trek. That was the show that I loved to watch. And the way that the devices that they would communicate with each other and being able to see each other on screen, that just seemed impossible, didn't it? I mean, to be able to do that, but now we do it every day. Well, when Marty was here talking to the doc, and they're looking at what's going to happen when they go back to the future. He says, and I adjusted this quote because there was a little bit of profanity used in this one. So I took that out and I revised it to say, if my calculations are correct, when this baby hits 88 miles per hour, you're going to see some serious burnout. Okay. He's talking about the flux capacitor in the car. We're going to talk about how our rapid advancements without control and without intention can lead to burnout. So let's look at where we are now to determine where we want to go. As was mentioned with Dr. Crowan, burnout is at an all-time high. I first started doing this resilience about 20 years ago, so long before the pandemic. And in fact, when I first began defining resilience as it pertains to nurses, I was told it wasn't even a relevant concept. My dissertation chair said nobody cares anything about resilience in healthcare workers or nurses. It's just for psychology field. Well, I changed my chair and moved forward because I really believed I saw that this was an important concept. We weren't talking much about burnout back then, but it was on the horizon. And that's where we need to keep our eyes. What's on the horizon and what can we be doing now to get to a better state then? So, just some statistics here. I'm not going to read these to you, but burnout is, despite everything that has happened and all of the efforts to address it, it's still going up. Moral injury, where a lot of my work has been in the past few years, specifically in nursing faculty and academic nurse leaders, but really looking at it across practice, is rapidly increasing in nurses. And this goes back to competing values and conflicts in values, and what Dr. Crowan mentioned as there's a misalignment between our purpose and our priorities and what we're actually doing in our work. There's critical shortages. I don't know if y'all have heard about the nursing shortage, but it's there and it's continuing. There's a physician shortage as well. Nursing shortage is on the rise. Uh, Predictions are bleak for the next few years, where there's an estimated shortfall based on the latest calculations of 500,000 RNs by 2030. We're in dire strait here. Nearly 50% of the nurses are over age 50, which means we're going to have a wave of retirements on top of this. Nursing faculty vacancy is right now at 8.8%, which limits the pipeline, but that's also growing. We're having trouble bringing people, new faculty in. And so there are multiple challenges in this. The last thing is I keep thinking, is nursing going to become extinct? Are social workers going to become extinct? Are providers going to become extinct? We're seeing a rapid decline in the number of applicants or people saying that they're going to consider these professions for their careers. I don't know if you've read the recent report that was published in the spring by the International Council of Nurses, and it's showing a global decline in interest in nursing and other service-oriented professions. And it's all going back to some of these themes. So where do we want to go from here? That's our current state. And I don't think any of us want to remain in this state. But we're finding in the Surgeon General's most recent report, as well as some of the other reports that have come out, is that many of the strategies that have gone into place since 2019, when the World Health Organization claimed burnout as an occupational phenomenon, those things aren't working. We're seeing a lot of energy and a lot of raised awareness around the topics of burnout and moral injury, but very few solutions. So we have to come together and really define where do we want to go and how are we going to get there. So in the past few years, I've looked at what are the root causes? What is really happening that's leading to these crises in our workforce, healthcare workforce? So we're seeing a lot around distraction. You may have read the book Distracted as relates to students, but it's also something that is happening to us. And there are multiple distractions that are leading to huge cognitive overload. If you're familiar with cognitive load theory, we only have the capacity for so much at one time. But we have multiple distractions that's leading to us not being able to focus, to remain engaged, or to be present. That goes with the second one, where there is cognitive overload. And we're seeing this very much in our students, as well as in our faculty and in our providers as well. There's just so much going on up here. And so we're not only distracted, but we don't have clarity. And we're struggling with that. There's a huge problem now in society of isolation and loneliness. We've never been more connected technically and technologically, but isolation and loneliness are at all-time highs. People don't feel connected to each other anymore. And we also have an addiction to instant gratification. All of these have come from those advances, things that we consider innovations or advancements, and they're good. All of the things that have happened have led to great things in other areas, but we have to learn to control and our response to these, not just all consuming, but how do we maintain an informed perspective and how do we use these wisely? All of the wonderful things that we have that allow us to improve the work we do, how do we harness that without letting it chain us? So, our destination is that we have a workforce that finds fit and belonging where they are and can find the right job in the right place to where they can thrive, where they have fulfillment professionally and where they can flourish. I've been doing some work and been invited to join some groups with the Harvard Human Flourishing Project recently, which is fascinating work and just really aligns with all of these themes. We don't want to just survive. We've worked too hard to get to where we are. We want to be able to thrive, and that means flourishing. And to do, it's not going to just happen by accident. We have to really chart our path and make wise decisions in doing that. And it's going to look different from everyone, for everyone. Abraham Lincoln, I love to read Lincoln's writings. I think that a lot of his work is so relevant to today. And I've been going back and reading some of his work. And one of his famous quotes is the best way to predict your future is to create it. And that just means taking control of where we are now and not letting it just happen to us, but really dictating and doing what we can to improve the future for ourselves and those that come after us. So I mentioned my work with Holocaust survivors. When I began my work in resilience about 20 years ago, most of my research and work was quantitative in nature. So I was looking at can we increase resilience in our nurses and our nursing students and medical students, et cetera. But there was something missing in all of that work. It was very data driven, and I love numbers. I love data, but there was something missing, and that was the human element. And I really wanted to understand how do these individuals think differently from other individuals who aren't as highly resilient. So I started talking to people who we would normally consider as highly resilient individuals. You can see on the screen some nursing students in white and blue. I was doing some volunteer work in Haiti at the time at a nursing school there. And this was shortly after the earthquake. And, you know, you talk about resilience. These people had undergone tremendous challenges, but yet they were right there and persevering and overcoming obstacles, you know, that many of us can't imagine. I also started working with Holocaust survivors, and I grew up. Um, my mother was a member of the Holocaust Society in Chicago, and I grew up around some Holocaust survivors and hearing their stories, and I just kind of turned my attention to really thinking more deeply about that, and I began involved at a more formal level. I'm a Belfer Fellow with the United States Holocaust Memorial Museum, and I started becoming involved in Eastern Europe in some of the Jewish societies there. I'm not Jewish, but they welcomed me with open arms and working with these survivors while they were still alive to gather their stories and to really understand how they think and how they respond to challenges in life and stress. And this is where I learned about the resilient mindset. It's very different. my research has shown, and others as well, that resilience is something that we can learn at any point in our life, and we can teach it to others. And that's where a lot of my work is with RN Prep, is teaching nurses and other healthcare professionals how to become resilient and how do we teach it in our curricula. The resilient mindset is a choice. It's not something everyone's going to choose because it means changing ourselves in many ways. There are some people who are more naturally resilient, but all of us can learn to enhance that in ourselves. So, speaking of 40 years, this was 40 years ago for me. And these were my initial questions about 20 years ago. But I was thinking about resilience without knowing that's what it was called when I was a brand new nurse. And I recognized then that we have challenges in healthcare that are not so much about our competence or about our capability, but more about capacity and about culture. And that there are many things that we can change and adapt that really can help us thrive and do better and to make it a better profession and one that others want to choose. So here, this is how I define resilience. And you can see there's been several iterations of this. It was originally published in 2013. I'm thinking maybe 2012, but maybe officially published 2013, but it's individualized and it's something that not only allows us to respond in the moment to the challenges that we're facing, but what we know from research is that it sets us up for success in the future. It has a cumulative effect that the better we practice resilience techniques, the better we are to handle future challenges. But the second part of this definition is what's most important when we're thinking about resilience in our healthcare workforce, is that it leads to an overall enhanced sense of well-being overall. So as our resilience goes up, we have a better sense of well-being even when we're facing challenges. And so it's an improvement in our own health and wellness at any state. Viktor Frankl, you may be familiar with him, has been a leading voice in my life as I've researched resilience and really looking at adversity and how we handle challenges in our life. He wrote Man's Search for Meaning. He is a Holocaust survivor himself, a psychotherapist. He lost his wife in the camps. And after he got out, he wrote a lot about finding purpose and meaning in the challenges that we face. One of his quotes that has stayed with me for a long, long time is this one here. Between stimulus and response, there is a space. So, between the trigger, the adversity, the challenge. So, when we first experience that and we step into that space of life's challenges, hardship, there's a space where we choose our response. And that gives us power. I just completed, or some of my doctoral students just completed a study using my model with nurse anesthetists. And in that, we found that as resilience scores increased, there was a correlating increase in self-efficacy, their ability to choose their response, and perceived stress went down. Their situation didn't change. It was still the same situation, but they were perceiving it as less stressful because they realized they had a choice in how they responded. Often, people who are burned out or on the path to burnout or experiencing moral injury feel trapped and that they've lost all control over their lives. We always have a choice in how we respond. My son, who's a medical physicist, very engaged in technology, is a huge fan of Rush. And when he was in college, he took me to one of their concerts. Now, I was never a big fan of Rush. I am now. But in one of the, and Geddy Lee, the lead singer of Rush, his parents were Holocaust survivors. If you didn't know that, there's a tidbit. One of the songs, there is a quote that if you choose not to respond, you still have made a choice. And many times we don't choose our response, we just let things happen to us. That's still a choice. So we can choose if we're going to adopt a resilient mindset and choose a response that's going to lead to a healthy outcome or a better outcome, or we can just let things happen to us and default to no response. But we all have that choice. And that's where sometimes it gets difficult. We may not like our choices, but we still have them. And we have to be able, that's where the resilient mindset comes in, being able to analyze the choices that we have and what we're going to do. So, in working around the resilient mindset and defining what that looks like, my goal was to learn how to teach it. How do we teach our new healthcare professionals before they enter the workforce how to be better prepared, to have that resilient mindset before they step into that? Because we know that academic burnout is very real for healthcare professionals. They're entering the profession, and this is across all healthcare professions, they're entering the profession already showing signs of burnout before they ever assume their license or their position. That's tragic. We've got to get to them earlier. So my method of this, the method to the madness, is based on what I call the 4 P's of resilience: purpose, priorities, perspective, and personal responsibility. When we measure resilience, or when we evaluate someone's level of resilience, especially if we're wanting to see if it increases through an intervention, we're typically measuring what are called protective factors. And these are the behaviors or characteristics that highly resilient individuals possess, and they are the buffers that allow us to mitigate our risk for burnout or moral injury. So these protect us during times of stress. They're things like faith, humor, self-efficacy, self-control, perseverance, a sense of support. All of these types of protective factors come into play. Well, as I was looking at the resilient mindset, I found that these highly resilient individuals have these in multiple places, and they seem to fall within these 4 themes. They all have a strong sense of purpose. They can tell you what their purpose is in any time they're in a state of adversity or challenge. They know their purpose. They know their priorities. They know who they are, and they know what they stand for and what they believe in. They have an informed perspective. They're able to see the big picture and not just react in the moment, but they can look, step back and pause and evaluate the situation. And then they accept their own responsibility and they're accountable for their choices. A lot of my work recently has been in the relationship between purpose and resilience. And we did a study with nursing faculty just a few years ago, and we had 690 participants from across the nation. And we found that purpose was strongly correlated to resilience, that those faculty who had a definite sense of purpose and knew why they were in their roles had a much higher levels of resilience. And the definition that we use for purpose with healthcare professionals is that it's something that is meaningful to you as an individual, but also has benefits to others. So again, back to that original slide of what is the purpose of healthcare, this is where this comes in. For the majority of healthcare professionals, nurses, physicians, social workers, anyone that is in healthcare, we find meaning and purpose in our work when we're serving others. And I serve on a couple of hospital associations advisory boards. And when we do these statewide surveys around wellness and well-being, we find that even in the state of burnout, healthcare professionals are still finding meaning in their work. So they strive for that, and we want that. We need that, and it's very, very important that we are able to find that wherever we are and whatever we're doing. So I'd like to pause for a minute and ask you to think just briefly. Don't overthink this. Where do you find meaning or purpose in your own work? What gives you joy? Where do you find the meaning or the purpose in that? This is something that I love doing with students, but also very experienced leaders, and seeing the connections there, helping others, giving back to nursing. The one thing as people are typing, if you saw that definition, and you'll have copies of the slides, purpose remains relatively stable throughout our career. Our priorities will change as we evolve and as we move through our careers, move through life. My priorities changed greatly when I had grandchildren. When those little babies entered my life, my priorities greatly shifted. But my purpose has remained relatively the same. It was to make life better for others. And so it's important that we name that purpose. And this is an interesting activity to do and something that I love doing with our new healthcare professionals. But again, I also love for others to share their purpose. So we can see here, if we were to break these down and we knew who was saying these, we could probably tell how far along in your career these people are. Advocacy is a huge part of people who are seasoned professionals, but it's also something that we see more and more of the new generation wanting to do. They're very value centric. And so we're returning, this is again back to the future, returning to our core values, which is where I see great hope. But finding your purpose is very individual and you really have to dig deep. So you have these overarching themes of helping others, but what is it about helping others? Where, think about those moments when you find meaning and how do you get more of that? And really looking at what does it really mean to help others to you? What are you doing when you're helping others specifically? Because it's important that you know that because you want to do more of that. In 2010, this definition came about to understand what meaningful work is. And it's a positive, fulfilling state of mind. Okay. And it's going to be very different for everyone. What's purposeful or meaningful for me is going to look different from anyone else. While we all may say it's in helping others or serving others, when I get down to the nitty-gritty of that, it's going to look different. I have to know what that is and understand that. And that requires a lot of self-reflection. So, this is where self awareness and situational awareness comes into the resilient mindset. Knowing who I am, knowing who you are, and where we're going to fit. We're not meant to fit everywhere. So, making choices and decisions based on our purpose and where we find meaning in work is critically important in understanding we can mitigate our risk for burnout and moral injury by making those decisions. And this is something we have to teach our learners to really think about this, where you're going to go. What does the work look like? Recent research shows that if we are able to fulfill our purpose or find meaning in our work a minimum of 20% of the time, we are greatly able to reduce our risk for burnout. We don't have to find pure joy and happiness and meaning 100% of the time. That's not possible. There's drudgery in every form of work. That's why it's called work. But if we can intentionally choose to do jobs or career choices or say yes to things that provide meaning and purpose to us as individuals, at least 20% of our job, we can greatly reduce our risk. Priorities is the second P. This is our values and our ethics, what really matters to you as a person. And this is another important exercise I encourage everyone to do to just really think about what are your core values as an individual? What are your ethical values? So as professions, many of us have ethical codes. Getting back to that and looking at the foundation of our professions, what should be driving our actions and our behaviors and our decisions? It's those ethics and those values that we embrace. What matters to us really matters. And when there's that conflict or competition between values of what we're being asked to do and what we believe is right, then we're going to be at risk for moral injury, moral distress, and burnout. So there has to be some alliance between our priorities and our purpose and what the reality of our work is. So this photo I took, one of the survivors that I work with was the youngest survivor of the Theresienstadt concentration camp just outside of Prague. She was there as a young child, and of course separated from her parents. And The last time I was over there visiting the camps, she lives in Long Island, in New York, and she asked me. She's unable to travel there now, but she can run circles around me most days. But she asked me to take a picture of her barracks the last time I went. So when I was there, this is the was the processing room for the new arrivals to the concentration camp. It's also called Theresienstadt or Terezin. You may know it as Terezin. If you've been to Prague, it's just outside of Prague. And in this processing room, I was able to spend a little bit of time in there. These are the actual belongings of some of the people that were brought to the camps. And so when I've been talking to the survivors over the years, I asked them a lot about their life before the Holocaust, their time in the ghettos or in the camps, and then after liberation. And a lot of their memories focus on those hours just before they left home. And they didn't have much warning. They didn't have much time to prepare. Usually it was a few hours, maybe a couple of days. And they didn't know where they were going. They didn't know what was ahead. Okay. They were basing it on just what they knew at the moment, and they were told they could take some things with them. Usually it was things they could carry. So like the survivors that I've worked with were children or young teens during the time, and they would load things up, their beloved belongings in pillowcases, usually for the children. The parents, if they had transportation or were able to get it there on a wagon or whatever, would sometimes haul these trunks and these luggage. So when I'm doing this activity with groups, I ask you to think about if you were leaving your home and you didn't know where you were going, you didn't know if you would ever be back, what would you take with you? And it doesn't have to be just things you can carry. It could be people or things, items that you have. What would be most important that you would have with you on that journey or at that destination? That's a glimpse into what matters to you. A few years ago, when I first started this research, we lost everything in a fire. We were homeless, and we lost everything that we had except what we were wearing, as well as our dog. My son was 16 at the time. We had nothing left. And I've recognized since then that there aren't many material possessions that mean that much to me anymore. I regained some perspective there, but I sure do value my human um, relationships. And so thinking about what really matters to you the most is an insight into what matters most and what you need to be giving your time to and your energy to. And maybe reclaiming some of that time when we think about our distractions and our disconnections. I like this quote by Jay Kaplan. Burnout comes from a loss of connection to the things that matter most to us. So, a lot of the burnout I see goes back to one of those original slides where we're distracted. We had cognitive overload. We've lost clarity. We've lost the connections that matter most to us. And we're doing lots and lots and lots of things. And we're working harder than we've ever had before, but it's not as meaningful to us, and it doesn't matter as much as it once did. We've got to get back to where we're doing what matters, and we have to do some things ourselves to get there. So these are just some statistics. I don't have time to go through these, but if you haven't checked your usage device on your phones, I would highly encourage you to do that. I just did that and I was shocked. And so now I'm getting daily alerts to help me. I call these forcing functions in order to do what I know I need to do. It's an addiction. We have all of these things that technology, these wonderful things technology has brought to our lives, but it's almost an addiction and it's an escape for many people to escape doing things that maybe take a little bit more effort. But if you look at the average time we spend on our devices, it is incredible. And when we think about what we've lost, in 1985, we didn't have these things. Well, gosh, we didn't have these, even 20 years ago at the capacity we do now. What were we doing with our time? Okay. Global average 6 hours and 40 minutes per day. What were we doing those almost 7 hours before? Maybe we need to reduce some of that and bring back some of those things that are meaningful and purposeful to us. That's my goal. That's what I'm trying to do. I'm trying to go for walks. I'm trying to have one-on-one conversations, not just through text messages or email, but connecting with humans and refilling my cup in those things that I've lost because of these things. Another quote by Frankel that I love is when we're no longer able to change a situation, we're challenged to change ourselves. There's a lot we can change about the systems that we work within, and that requires policy, advocacy, collective efficacy, all of us coming together to change the things that are driving burnout and moral injury. But there's also things we can change in ourselves. And this is one of the hardest things about the resilient mindset is that we have to own that. And we have to be willing to set some boundaries on ourselves and change some aspects on how we respond to stress and adversity and make that choice. Are we willing to do that? To protect what really matters to us, we may have to make some hard choices and do some hard work on ourselves. Balance is a verb. We talk about work-life balance. I don't think that really exists. There's harmony, life and work. There's a blurring between the lines of life and work now, and that's just part of innovation. We have the ability to be connected 24/7, but we can control how we're connected and when we're connected. I like this model of it's called the six full life aspects, and it's the full life framework. If you think about life, your life, in these six categories, where do you need to reclaim? Or where do you need to have a rapid response? Before I entered research and academia, I was a trauma nurse. So I was in practice for a little over 20 years. And I think of everything as a rapid response or a trauma code. So where do we need to jump in and stop the hemorrhage? Um, So think about that now. Which of the three aspects of your life needs your immediate response? Just choose three. Is it your physical health, family and relationships, wealth and money satisfaction, work and career, spiritual wellness, or mental strength? When you're thinking about where you can borrow time, we can't really borrow time. We can't buy it. We can't steal it. We all have the same amount, but we can reallocate how we use it. That may be where you want to readjust how you're using your time. And these responses that we're seeing on here is consistent almost every time I do this and I talk about this. Almost always, people want to reclaim the relationships with their family and the people they love, reconnect. That requires an effort and changing how we operate. We have slid into um, a method of relating that is so different from what we used to do. When you go back and watch Back to the Future or any other of those old shows where there weren't mobile devices and there wasn't internet, what were people doing? They were together and they were spending time together and talking together. I love remote work. Gosh, I'm a huge advocate for that. I love online learning. I've spent much of my 20 years in education working on best practices in online learning, and I love it. That's where I thrive. But I can't let that be all I do. I've got to really harness that other time and make sure that I'm spending it with the people and the places and the things that matter most to me. So this is a good indication of what I normally see. Physical health, family and relationships, spiritual wellness. Those are almost always the top three of where we really need to focus. Do y'all know who this is? Socrates. I love Socrates. I'm a huge um, fan of Socratic thinking, Socratic questioning. I'll actually be in Athens next week, walking the steps of Plato and Socrates, and I love going back and reading some of these old philosophers' views. They're very relevant to where we are now. Basically, what he's talking about here is the third P in my 4P model of perspective, of having an informed perspective. It requires great humility and curiosity to do that. We have to admit that we don't know what we don't know and that we never know it all. I always say if we ever get to the place where we think we've arrived, we need a new roadmap because there's always something we don't know, and there's always someone who knows that. So, seeking wisdom from others and connecting and being able to admit that things have changed, that knowledge has changed, and being able to adapt to that is a huge part of the resilient mindset. Continuously asking, what is there that I don't know about this? And who knows that? How can I gain a more informed perspective to make a better choice or a better decision instead of just knee jerking and reacting based on what we know at the moment, but actually taking a pause, taking a breath, and seeking information. A lot of times it's in that moment alone that we reduce our stress and make a better decision about what we're going to do. The fourth P is personal responsibility. And this is the hardest part of all. When I do these workshops, I have the RN Prep course where it's modules and spread out usually over a semester. But in workshops, when we do this, it's usually 1 or 2 days. And this is the hardest part for everybody. We like to talk about changing the systems, but what we don't realize is that systems don't change until the people within them change. And that's not just pointing our finger at everybody else. We have to change too. We have to own that responsibility and be willing to look at ourselves and say, how can I change myself right now to better handle what I'm dealing with or to promote change in the system and not just waiting on that to happen around us? That requires personal responsibility and accountability. We have to set boundaries for ourselves and our teams. I've been working a lot with my academic team. I'm an associate dean at the Medical University of South Carolina, and we've been looking a lot at setting boundaries and using these forcing functions that as leaders, we model healthy behaviors. We have the ability to be connected 24/7, but that doesn't mean we should be doing that. So, setting limits on when emails are sent and the expectations around responding to emails, setting healthy boundaries about separating work and life, and that people matter more than other things. So we have to clarify that sometimes, but most importantly, we have to model that. The American Medical Association has a really unique take on this on purposeful imprinting, and it's something that we have to teach to those joining the profession, but it's also something that we have to do with old timers like me who grew up in a time where workaholism was just getting started, and we were taught to give it our all. And the version of a work ethic meant, giving your life to your career sometimes, and that's not healthy. So we have to go back to a time to where we really think about what did work look like before we had this and reclaim some of those habits and those behaviors. And that's going to come from setting some healthy boundaries. So, how will we go back? Well, I've been doing some work around what are the predictions for the future and really looking at the different eras and ages in time. So, the Industrial Revolution. We're currently in the information age, which began in the mid 20th century, but really has progressed since the 1980s. Those things that I was talking about, evidence-based practice, um, the internet, and all of these things around technology. We know that technology is rapidly increasing and our knowledge is rapidly increasing at a rate greater than ever before, especially with the introduction of AI, which is fascinating to think about where we're going to be. There's a phenomenon called the end of history illusion that really, I think, traps us and keeps us prisoner. And that is that we recognize the change, the amazing changes that have happened behind us in the past, but we don't recognize fully how much is ahead. We think things will stay the same more than they do. We can't even fathom the change that's going to occur even in the next 3 to 5 years. When we think about how AI has progressed in just 2 years, it's 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 going to blow our minds in what's happening in the future. But we can control what we do with that. We can, if we're purposeful and intentional and approach this from a resilient mindset, we don't have to let it control us. We can make these decisions and use it wisely and use it to benefit our students, our patients, ourselves. But it's going to take a return to our purpose. We're going to have to get back to those basics of our values and our purpose and reclaim those using ethical design, an informed perspective, and resilient systems, and building those intentionally with the future in mind, not just where we are now, but how are we going to use this and have optimal outcomes in the future through these stages. So we reclaim our purpose through compassionate courage. A lot of my work is recently has been in moral courage, and that's the willingness to stand up and speak out for what is right despite risk. We find that, especially within the healthcare professions, there's a lot of risk in doing that alone. But we can do it collectively, and we can stand together and we can advocate for changes in policy and changes within the systems, recognizing that humans are on the end of that and do it within the lens of compassion. And that we want to preserve relationships, but we do also have to speak the truth and we have to address the facts. Personal resilience, of course, is one part of this. Ethical leadership is very, very important that we have leaders who embrace the core values of healthcare and the purpose of healthcare and advocate for policies and changes that are aligned with that. And then move the boulders that stand in the way through the efforts of resilient teams. And that's where collective efficacy comes in. It's a lot of risk for one person to try to change the system alone. It's impossible. So that's where resilient individuals, guided by ethical and resilient leaders, come into play. I see great signs of hope. So I took this photo a few weeks ago. I'm at the Medical University of South Carolina in Charleston, South Carolina, and on one of my walks, a storm came up and a huge storm. And I was walking and I saw out at sea this little fishing boat, and you can't really see from the photograph. I just had my phone with me, so I just took it with my phone. But this little boat of people fishing were completely covered by this horrible rain cloud. It was black. I mean, the skies got so black so fast. There was lightning, there was thunder, and from my perspective, I was looking at this boat. It was completely dark. And I imagine I stood there and I said a prayer for them, and I was thinking they've got to feel terrified right now because they don't see anything outside of this darkness that they're in. Excuse me, completely dark. From my perspective, I see the light just beyond them if they can keep going. There's light ahead. If they can just keep going a little bit, it's they're going to get out of that storm. Keep rowing, keep working toward that, and they're going to see some relief. And I thought, that's really where we are as healthcare professionals right now. It feels bad. It may feel hopeless at times, but there are signs of hope all around us. The new generation coming in are very values driven. And there's a lot of predictions about the age that's coming after the information age, and it's a return to values. The decrease that we're seeing in people choosing healthcare as a career is based on a lot of it is based on what they see right now. But if we can give them hope that are the change and that we can get back to a values-based, purpose-driven, mission-focused healthcare, we've got a huge number of people just dying to get into that and to serve others. So I see great hope. I believe we're at a tipping point. Um, it's just ahead. We just have to keep rowing. And I believe I'll see it. I'm not far away from retirement. I have a few years left in me. And I do believe that I'm going to see a change. I believe that we're almost there, so we just have to keep going and we'll do this together. So that's it. I don't know if I have time
Mhm.
for questions or not. I think
Yeah,
we have
we
a few minutes
do.
left for
Yeah.
questions. Okay, super.
Um,
I'm going to quit sharing my screen then.
okay. So, I did notice, Dr. Stevens, and I don't know with your program there, it looked like there was one question, and I don't know if that was it was in your system, but not in our Zoom system. But I do just want to let you know, we're going to open up for questions now to the audience for Dr. Stevens. And if you do have any questions, please remember to put them in the Zoom Q&A feature so that we don't miss that as opposed to the chat feature. You use the Q&A. But So, we'll wait just a second, Dr. Stevens, and see if anyone has any questions. But I know one thing as a nurse educator myself, I've seen kind of a trend. We have we have graduates coming out, and we're kind of hearing from some of the healthcare sector that they're not always staying. Once they're going in, they're excited to get into our nursing programs, and then they're graduating but then they're going into healthcare. What kind of advice would you offer for those that are seeing that kind of a trend?
That is such a great question. And that was, real originally what drove me into this work. I talked a little bit about when I was a new nurse. The photo I showed was from 1986. But I that's when I first started thinking about this, and I wanted to run away too. I recognized that the culture was very different from what I expected. I was very well prepared to deliver good patient care. I wasn't prepared for the realities of work. And so back then, I remember very well standing in what we called the medicine room in the ED at the time, getting ready to deliver blood to a patient. And I remember standing there thinking, it shouldn't be this hard to do this work. There's all these things around me happening and that have nothing to do with actually patient care. And I made myself a promise then that if I could ever improve that for other new nurses or healthcare professionals, that's what I would do. I didn't realize that was a resilient mindset then, but that's where this is now. And I think a lot of it is that we still don't prepare them well enough for what they're stepping into. And it doesn't I've had people say, well, if you do that, they're not going to want to go into it. I don't believe that's true because since we've been doing this, and now many accrediting bodies are requiring the integration of resilience content for professional development or for uh, practice readiness, it's because of that it's awareness and preparation that there are things they can do to withstand those challenges that make them want to run away. And they don't know what to do. They get in there, they've never handled it before, maybe. We do know that brain development now is very different from what it once was, and the responses to challenges and adversity, if they haven't been given those skills before, that may be the first time they've ever faced something like that, and they don't know what to
Sure.
do. So it's very important, I think, as educators that we're preparing them, and we actually model these things. We bring it into simulation or into case studies, and we talk about um, workforce challenges, chronic stress, how to handle that, moral distress, ethical dilemmas, and really work through some of that with them to help them be prepared, just like we prepare them to handle a code and all of these other challenges. This is just as important to know
It
how to
is.
behave as a professional.
Yeah, absolutely. We do have two questions. We have about 2 minutes left. So, um, one participant said, "Thank you so much for sharing your story and insights from your research. Can you share a little bit about the RN Prep program and audience?"
Sure. I'm currently revising it right now. We introduced it as a virtual program almost 3 years ago. It'll be 3 years in January, and have done a lot of research and data collection around that. It's a self-paced asynchronous course. It's currently in revisions, but I have multiple programs that's been fully integrated through several states and used in nurse residency programs as well as in um, undergraduate programs, graduate programs, and with leadership groups. If you want it, anyone's welcome to take it. I do ask if you're using it for research purposes, which there's a lot of doctoral students that are using it now, either for their PhD or their DNP
Hmm.
projects. I do have a couple of things that I ask you to sign for that. But it's free for anyone to use that wants to use
Hmm.
it.
Very
Just
nice.
send me an email and I'm happy to give you access.
Okay. And I believe Kelsey had shared your email
Okay,
as
sure.
well. So so we're getting close to the time. I do know we have one other comment here. We offer a leadership institute here at Louisiana Action Coalition, and some of the leaders for that have been hearing from nurse leaders that nurses refuse to serve as mentors. Have you been seeing this or hearing that kind of same thing across the country?
Yes, and a lot of it goes back to capacity. We have to remember there's a difference in capability and capacity. These are highly capable individuals usually who would probably love to do that, but they just don't have the capacity to do it, and they're recognizing that. Um, we didn't talk a lot about the specific changes that came about with the introduction of evidence-based practice and the internet, but one of those was critical thinking. And so the good thing is that they're really thinking and they're evaluating their ability around capacity and what is safe and what is feasible. There's a lot of fear as well about making mistakes and errors and the punitive or possible risks in doing that. So it's a very real problem where people want to do this. They feel like it's definitely necessary, but what I'm finding is that they say no due to a lack of capacity and a
Mm,
fear of not
yeah,
being able to fulfill their responsibilities adequately. Some may be full-fledged burnout. So it's hard to, really understand that until you get to a very granular level and looking at the individuals. But we're seeing a lot of both. One is a fear of not being able to fulfill their responsibilities and deliver care at the level that they believe because of a lack of capacity, or they've lost the ability to care through burnout.
yeah, absolutely. Well, we're right at our time, and I just want to thank you, Dr. Stevens, for sharing your work and the inspiring information that you've shared with us in a powerful keynote presentation. You've definitely reminded us that resilience and courage are not just abstract concepts, that there's tools that we can use that can help us reclaim our purpose in healthcare. And I think that's hugely important that we do that. So thank you very much.
Thank you all very much for having me, and I wish you great success. I know you're going to do great things. It sounds like you're on a great path. So thank you very much.
Thank you.